Hi, my name is Katelyn Fowler, and I'm a student doctor of physical therapist at Regis University. Prior to Regis, I earned my bachelor's degree of exercise science at Westchester University of Pennsylvania. This is where I taught fitness classes and became team leader of fitness. Since middle school, I've been passionate about movement and living a healthy lifestyle. This has positively impacted both my physical and mental health. This passion is what led me to pursue a career in physical therapy. However, I've also struggled with exercise addiction and eating disorders for many years. In 2020, my body essentially shut down. I could not walk comfortably for 6 months. I endured chronic pain, extreme fatigue, joint numbness, and suffered from sleep loss, depression, and a racing resting heart rate. After months of chronic pain, endless doctor visits, and no answers, I knew it was my lifestyle that needed to change. I began to eat more and exercise less. This experience showed me that there really are many different pillars to health, not just physical. I'm 30 pounds heavier than I used to be, but I'm also the happiest, healthiest, and most in tune with myself than ever. Treating patients as the whole person and looking at the biopsychosocial aspects of their lives will always be a priority to me. My personal experience with chronic pain and neurological symptoms sparked my interest in treating complex neurological conditions such as MS, Parkinson's, vestibular disorders, stroke, traumatic brain injury, and spinal cord injury. Although I can see myself working with high-level athletes as well, as I grew up an athlete myself, and I still love working with athletes of all fitness levels. Both settings and patient populations are rewarding to work with, and I am very excited to gain more experience with them. One of my greatest strengths is my ability to adapt quickly to new situations. I do believe that my CI would say that I can take feedback very well and can apply it almost immediately. During my first clinical, I was doing about 13 to 14 hours days, which took the hour to drive up there, treat patients for 10 hours, and then drive 1 hour home while making time for me and the people I love. A key strategy during that time, and always, is to start my day early with a morning routine that sets my mind up for success. This helps me to stay grounded and think clearly under times of stress. Over the years, I trained myself to find the silver lining in almost any situation. With this said, another one of my strengths is my optimistic mindset. I believe in the power of a growth mindset and aim to empower my patients, helping them realize that they are stronger than their current challenges. I have a natural ability to build patient rapport. This is because I deeply value my own relationships with others, and I hope to show my patients and all that I interact with that they are seen, heard, and validated. Other than my interpersonal skills, I have excellent time management and problem-solving skills. I highly value feedback, as I believe others have valuable insights to offer, and I'm committed to becoming the best physical therapist that I can be. During my first clinical education, giving and receiving feedback felt easy. My instructor and I were open about expectations, strengths, and areas for improvement. I very much enjoy being challenged and pushed outside of my comfort zone. To best prepare for clinical, I review all the appropriate skills and content areas for the setting that I'm in. I plan on taking electives in the fall for dry needling, vestibular rehab, and exercise progressions. After graduation, my goal is to work in an environment with skilled, motivated, and inspiring physical therapists who are committed to growing together. I believe it is easier to improve when surrounded by others who are equally as dedicated. I value strong mentorship and collaboration. Ideally, I'd like to be getting mentorship in neurological management, but mentorship in any practice area that I'm in would really excite me to help me develop my clinical skills. I am seeking an organization that fosters growth and supports new grads. Thank you for your time, and I look forward to hearing from you.